Hello, and thank you for taking a little bit of time out your day to listen to this video. So I have been wanting to do a new video for a couple of weeks now, and my intention was to talk about spring and talk about how the winter was coming to an end, but I'm afraid the weather that we've had over the last 10 days or so has delayed me somewhat. So today I've been outside and it feels like spring to me, so I'm going to do it today. But please, I take no responsibility whatsoever if we all wake up tomorrow with a covering of snow again. It wasn't me. So, as I say, I think it's really important that we all just take a minute just to stop and think about what the last few months have been about for us as a health and social care partnership. So, good news has been around for the last few days about changes to the restrictions that we're all living under, and some really good news stories around the numbers of people vaccinated and the level of COVID that's in our communities at the moment. So much for us to welcome, so much for us to look forward to. But I would, if I could, just like to take a wee minute just to talk about what the last few months have been like for us as a partnership. So we came through the first wave of COVID. We all worked really hard. We kept our services going. We dealt with people with COVID. We dealt with people with other conditions, and we managed to keep going throughout. We changed and we adapted at a rate of knots and speed that I don't think any of us have ever done before, and we managed to get through that first wave. Second wave came, and as we predicted it would, in a time of winter when we know that we've got higher levels of activity than normal. We have managed a second lockdown. We have managed being apart from our friends and our families. We have managed maybe homeschooling and all of the challenges that brings. We have managed restrictions in our workplaces. We have managed working from home. So we've had an awful lot of new things to deal with. Since mid-December, we have managed a vaccination programme that, quite frankly, I don't think anybody thought was possible. And now to have vaccinated the huge number of people across Aberdeenshire that we have is a remarkable achievement. So as we stop and take breath this springtime, I think we've got an enormous amount to be proud of. And personally for me to be very grateful to you all for everything that everyone has contributed over this time. So spring always feels like a little bit of an opportunity for a bit of change, and indeed this spring is going to bring change for us. So we will move on to the next phase of our COVID journey. I think we all know it's not over yet. We will need to be on our guard for new variants. We will need to be on our guard for any increases in the number of cases that we see. And we also know that we want to rebuild our services, which will take time and it will take energy, and it will take all of our ability to be able to do that in the way that I know we can. But it's also probably a bit of a change for me, and I will be stepping down as Interim Chief Officer for Aberdeenshire Health and Social Care Partnership at the end of this month. And our new Chief Officer, Pam Milliken, will take up her role probably mid-May. So I know that you will all welcome Pam into the role, and I hope that she realises just what a fabulous team that we have here in Aberdeenshire. And I know that you will go from strength to strength. So this is probably a little bit of a farewell message from me as well. So I would like to take this opportunity to thank each and every one of you for your contribution, not only through this year and a half when I have been the Interim Chief Officer, but for the years before that when I worked in Aberdeenshire, and have had the pleasure of meeting so many of you and working alongside so many of you over that time. So my very best wishes for the future, and my thanks for all that you have done over this time. Thank you.